Welcome back, everyone, to Open Line. Talking about medical malpractice. Have attorney Clint Kelly with us and a bunch of calls. We're just going to start going through the phones here. Explain your situation as succinctly as possible, and we'll let Mr. Kelly talk about it. Let's go to Alan. Hello, Alan.
Yes.
Go right ahead.
Yes, I'm a live hostage patient now. I got pancreatic cancer.
Okay. Oh.
And I was going to Tennessee Oncology. Plus, I also went to my primary care doctor who used to work for oncology. She had suggested that my doctor remove part of my pancreas that had it wasn't advanced as it is now. And then she told me to suggest him to move my liver, the part that had one lesion on it at the time. And he never acknowledged that or nothing about trying to remove that or nothing. Now, like I said, I'm in live hostage now.
All right, thank you. Thank you for sharing. Do you have any question here?
Yeah, Alan, when were you diagnosed with pancreatic cancer?
Back in July.
And how old are you?
I'm 52 years old.
And has your doctor led you to believe that had you gotten an earlier treatment, or perhaps...
He led me to believe that the treatment, I did the IV treatment of chemo, and then they changed that from the pill form of chemo, and as I started the pill form, it just got worse.
But has some doctor told you that had you gotten treated differently that you...
I probably wouldn't be at the stage I am now. My primary care doctor used to be an oncology doctor.
All right. What I want you to do, Alan, when you get tomorrow morning, I want you to call my office, ask to speak to Pat. Pat will get some more information from you. I want to get some of these other callers on, but I want to know what your story is. Will you do that tomorrow?
Thank you, Alan. Thank you. Yeah, we just let's go to Lonnie. Hello, Lonnie.
Hello, excuse me. A little over a year and a half ago, I had a motorcycle wreck. I had a place on the side of my leg muscle. It was more of a grass. I landed in a ditch with high grass. The grass made a rash on it, of course, scraped up against it. And that's all I believed it was, because I've had them before. I'm a type 2 diabetic, which I feel for some of these other people that's worse than me. I'm 56, years old. I got diabetes bad. Well trained on it now. But anyway, surgeon, I went to a doctor. Sir, he put me right in the hospital, said it was infected real bad.
Right.
And usually I can tell when I'm infected somehow or not. But anyway, he did surgery. After the surgery, I could put my fist all the way to my shin bone. It was opened up that much. I had to finally go to a wound center. All right. This doctor wouldn't even see me after the surgery. After he did the surgery, I was supposed to have a follow-up. He wouldn't even see me for the follow-up.
So what do you think your claim would be?
Well, it was a lot of malpractice there, because I wasn't even infected. And I had 2 other doctors tell me that. But anyway, I went to a lawyer after that.
Okay.
A lawyer told me, well, he's, a certain doctor, he's going to be indicted. I heard this. This is what the lawyer is telling me. He's going to be indicted soon now. If he gets indicted, we're going to do something with it. That didn't even make sense to me, indicted or not.
They should move on with it. All right, what do you think of this?
Well, the indictment's a whole nother ballgame. If it's related to the treatment, or if the doctor's got a drug problem, which sometimes happens. But I can't really tell from him whether he had bad surgery or bad post-surgical care that led to an infection. It was kind of hard to tell from what he was saying. I just don't know enough about it, but it sounds like he's getting care from subsequent physicians, and hopefully that will solve the problem. But he's got a lawyer. It sounds like the lawyer's sort of waiting to see how things are going to develop before he takes the case or before he files the suit. So just, Lonnie, I'd stick with what your lawyer has to say and follow his advice, because that's what you got him for. Is
it tougher that it came from a motorcycle accident? Is that tougher in front of a jury or not? I
don't think so. I mean, hospitals and doctors are supposed to take all comers, and unless unless Lonnie's out there drinking and driving or drinking and operating a motorcycle, I don't really think that makes any difference.
All right, let's go to Jared. Hello, Jared.
Yes.
Go right ahead.
Hey, I got a quick question. Not so much maybe a malpractice, but maybe a negligence case. My wife fell ill for a couple of days. I showed up at home. Subsequently, I had to call 911 because she was unresponsive. She stayed in a hospital, in a local hospital, for 11 days. At that point, lung doctor got involved, heart doctor got involved. They life-flighted her out all the way to Nashville. Come to find out, when we get to the hospital in Nashville, the doctor had told us that she had had a prior heart attack prior to her even showing up at the hospital that we were at. Now, for 11 days sitting at this hospital without them knowing, the hospital knowing, is there anything that could possibly be done?
That's possible. If she had a heart attack and they failed to diagnose or treat it and she had more damage to her heart because of that, he may have a claim, and it would be a healthcare, we call it healthcare liability now, that type of claim. I think what would be the key in that is how much more damage was done as a result of failing to treat it before it was ultimately diagnosed and treated. I can't tell enough from his call, but that would be the big issue there.
And is that a big area? Is that often something that's misdiagnosed, a heart attack?
It used to be, Ben. I mean, now if you come in with chest pain, I mean, it's heart attack until proven otherwise. And so it's pretty rare nowadays for emergency rooms to let you go if you come in with chest pain or signs and symptoms suggestive of a heart attack. It still does happen, but it's pretty rare now.
And when it does happen, that could be a problem.
Oh, yeah.
Yeah.
Definitely.
Let's go to Linda. Hello, Linda. Linda, are you there?
This is Brenda.
Brenda. I'm sorry. I can't hear. Go right ahead, Brenda.
Sir, the reason why I'm calling is because I heard you say for the age, a person being 65 years old, which is what I am.
Right.
I had gotten hurt at work maybe a year or so ago, and they diagnosed my back as a strain. I have a strain to my back, but they said that my back would never get better. And I went through the Department of Labor. They contacted me. I never contacted anybody. And I was going through therapy, and I was going over it on 21st to the orthopedic doctors that they sent me to and everything. But what they wanted to do is to give me $3,000 and pay my medical bills for the rest of my life.
Do you understand what...
Sounds like she's talking about a workers' comp action.
Okay.
Is this a workers' comp case, Brenda, that you're talking about?
Yes, but the reason why I was bringing it up because you said how people are treated when they're older.
Right.
Right. Now,
and I know you're not talking about workman's comp. You're talking about malpractice.
That's right, Brenda. They're two different things. When I'm talking about the difficulty in taking cases for people that approach retirement in medical malpractice cases is because of the damages cap, tort reform. Workers' comp is a totally different situation where you simply determine what the person's earning capacity is, how much impairment there's been according to an AMA rating, and then they will pay your medical expenses for that injury. Totally different scenario.
All right, let's go to Donald. Hello, Donald.
Yeah.
Go right ahead. What was your injury, and go right ahead.
Okay, thank you very much. My name is Don, and okay, I'm not sure how this goes, but because it's the government, I had a severe earache for about 3 weeks, and I finally went to my primary care doctor, and they told me to put Vaseline in my ear, and I did that for 6 months. Now, on my 6-month appointment, I told him, hey, man, this ain't working. So he said, well,
that sounds terrible. I mean, that's ridiculous.
You have a dry ear.
You have a dry ear. Okay.
So I went to the emergency room twice at the Veterans Administration. They gave me some kind of drops to put in there. And finally, the lady whom I had contact with a couple times, she referred me to the oncology or eye, ear, nose, and throat guy.
Okay.
He sticks a bunch of wires in my nose and throat and stuff and says, man, you have a bad cancer in your throat. So I freaks, right? He says, yeah. He says,
okay, well, let's talk about that.
Good.
So that seems to be a case where something was misdiagnosed. Assuming all of that is true, you have a doctor that said, treat it this way, and it turns out he has a severe type of cancer. What do you think about that?
Ben, Donald lost me with Vaseline in the ears. If that is so far beyond what I would expect to be, if that's good medical care, then I'm learning something new. If you misdiagnose one part of the body because you're treating another, then obviously if there are signs and symptoms suggestive of that, then you might have a claim. But that is bizarre, to say the least. And so it's hard for me to comment on something like that.
And do you hear cases like that where the doctor gives some remedies that sound so far-fetched, and does that make the case more doable?
It might. I mean, they're so rare, Ben. I mean, it's almost like you're talking about quacks, quack stuff, and that's a whole different ball game. And usually, when I hear about cases like that, usually the injuries aren't that bad. But but Donald's situation is, I just can't comment on. It's so
I don't know.
different.
All right, Donald, thank you for your call. A couple people still online. Hold on the line. We will get to your call. If you want to call, there's the number 615-737+. We'll take a break. Be back right after this.